in the Northern Cape, advocating for early detection of cancer, believes access to healthcare in rural communities is still a major challenge. Dr. Tshego Gopane realized that in most cases, local communities and rural areas lack information about cancer, and so she established a community-based healthcare project. She performs screening of lifestyle diseases, HIV, cervical cancer, and has recently introduced prostate and breast screening.
It's been more than 5 years since Dr. Tshego Gopane started her Tshela, meaning to be alive, consulting project. She was driven mostly by empowering those living in rural communities by attempting to change their various health issues. Dr. Gopane believes in sharing medical information to those less privileged.
Because of the rurality, sometimes they're not empowered with knowledge. So the primary was really to advocate health and to engage and go down to the most rural area and say, this is what a pap smear is done. We can bring it to you. This is what happens to you when you don't do a pap smear. So the drive was really to just make a broad change in the most rural communities who are disadvantaged.
Despite her efforts, the waiting list at public hospitals remains a challenge.
When we have identified illness, because of the challenges of the healthcare system, which is burdened, 84% of our people use the public health system. And in the rural location, it's transport issues when we refer. Our referral center is Kimberley. So there are long waiting periods for our patients to get treatment. A lot of transport issues when they have to shuttle between Kuruman and Kimberley where they need to get care. So it becomes a frustration both to me as a practitioner and to the patients who would come back 3 months later and they have not really seen the gynecologist that they need to see or the specialist.
She has been performing free pap smear screening for rural women, and early detection saves lives.
I got
relieved the moment the hospital told me they didn't detect anything. I was happy because there were moments where I thought the cancer might have spread. But once the doctor said there was nothing, I was happy. I was referred to the Kimberley Hospital and got tested there. They gave me pills. On my second appointment, they slightly cut my womb, and I had to return on the 27th of January, where they told me I was cancer-free.
Motivated by social justice, Dr. Gopane has always had a social consciousness to do anything that can make a change in rural communities. And her services are saving lives, one patient at a time. Refilwe Mekoa, SABC News, Kuruman in the Northern Cape.